And growing, and we are now in excess of 135,000 people. The residents of this county need good medical services. We're looking for the growth in the business community, including professional services such as your practice. So we thank you for your commitment to this area and to the city of Lebanon.
You're welcome.
We have a number of people here, a number of dignitaries with us from our public sector that I know want to help recognize you as well. We're also pleased to have with us today all three of our county commissioners, Commissioner Bill Ames, Commissioner Joellen Litz, also Commissioner Bob Phillips.
Well, thank you for becoming and remaining a member of the Lebanon Valley Chamber of Commerce. I'm sure it will stand you in good stead, and it will be very helpful to you in your endeavors. On behalf of the Chamber, I'd like to wish you congratulations and best wishes, and present you with this plaque, which has your first dollar of profit in your new facility, and I trust there will be more to follow.
Thank you.
It's over to Dr. Nazeeri at this point, and maybe you want to introduce, maybe you'd like to introduce your staff members.
Okay, I'd love to. First, my wife, who's my office manager, Sarah, has made this all possible. She's encouraged me from the beginning and always made me work a little harder. And I never complained. And I've had absolutely outstanding help. Chris Osterhaus has been with me the longest and helped us transition here. And we have a lot of experience. Sean Stone worked with Dr. Ganau, and she worked with Steve Weiner, and she has decades of experience in healthcare.
A couple of years, thank you.
Stephanie Schilling, you know, we've invested in people here in the community, training, and you know, sometimes you have to train your own people, and I think, you know, she's an example of someone who has come through our own practice and learned a lot. And, yeah. Angelica Vega is she came trained as a medical assistant and is incredibly personable. The patients love her, and she's indispensable. So there are other people that aren't here today, and you know, the kind of competitive environment we're in, where healthcare is readily available, requires this kind of help. You know, you've got to look at every single person, and the kind of patients that come to us are often very VIPs in a sense that they, whatever walk of life they're coming from, they want very special attention, and we try to tune into that and then get them, you know, exactly what they need. And in most cases we can solve their problem here, and if we can't, we can help them navigate the healthcare system, because you know, my area of medicine turned out to be the most interesting one. You know, I could have picked orthopedics or neurology or dermatology, but it turns out with the information technology and what we can do, and I'll show you in a minute how we deliver health care in this century, and we're about 10 years ahead of our patients right now with the way we collect information, the way the interaction is designed, the way we interact with other healthcare providers and pharmacies, and integrate that all together using, you know, basically the internet. Is phenomenal, and you know, the real-time aspect of it all, where the patient leaves with a document that says they got, you know, their pneumococcal shot in the left arm and their meningococcal shot in the right arm, and that they are getting this prescription and they're getting the MRI, and they know where they're going to go and get that, and they get, you know, texted or emailed to remind them of all of this, and you know, they're coordinated, you know, with other providers in a way that we actually came up with. Using that technology and enabling face-to-face interaction with the patient. So what was happening at our old location, and what I see in all the other healthcare offices, we're all using some type of electronic device, and it sits on a counter, and the back is turned to the patient, so you don't have eye contact with the patient. And, you know, the patients don't realize all this stuff's happening. It doesn't make sense because they didn't ask for it. It was designed by, you know, government and academia and insurance companies, and it's all pretty good stuff. It makes sense, and we'll grow into it. It's like infrastructure. It's like highways and roads. You know, the patients don't quite understand it. They get a document that goes home. It has all their meds. It has the med that was taken off, the med that was put on, the dose that was adjusted. They, you know, if they want to understand it, sometimes it's a little confusing to them, but it's really designed and thought out. And like I said, we designed the room when we remodeled to make it so we could use that technology and use speech recognition and document in front of the patient so they hear what you're saying about them, they know exactly what you're documenting, and then they leave with that information. So you'll see a little slight variation in how the room is set up, and that is a small contribution, but it does enable that face-to-face contact with the patient throughout the visit.
Dr. Nazeeri, I think on behalf of everyone here, we want to offer our congratulations to you, Sarah, your entire team, and thanks for what you've done. Well, we have one more thing to do yet. We'd like to do a ceremonial ribbon cutting.
You have to hold it here so the sun is in it.